one thing I really liked doing as a postnatal midwife working on the wards was help women to learn how to hand express colostrum. It's a really great skill to have, and there's increasing knowledge now on the benefits of expressing during pregnancy to give yourself a bit of a stash for when baby's born. Some babies have a higher requirement for calories and for intake when they're born, and these are babies excuse me, such as babies of women with gestational diabetes or type 1 diabetes. Also, say babies that may come out with a difficulty in latching, so babies with cleft palates or palate abnormalities, babies with cardiac issues. If you're anticipating your baby may have maybe need to be separated from you post-birth, having a stash of colostrum in the freezer is invaluable. It's an amazing substance. It's almost like it is a live substance. It can't be replicated in any lab, and it's proven now to be better for newborn babies than having to supplement with a formula. And again, babies who have the potential to have a cow's milk protein allergy, if we can avoid using infant formula and we have a stash of colostrum for these babies, it's a really good start for their gut. So working on the postnatal ward, I really, really liked helping women learn how to hand express, because it's not something that that is intuitive necessarily. So I want to show you a couple of things that might help make it easier for you. But again, as with all of my advice, you should always discuss anything that you plan on doing with your care provider, your midwife, obstetrician, GP, whoever is your primary care provider during pregnancy. So always run everything past them and have a good look into it yourself. But hopefully I can give you some ideas of things that you can research and look up for yourself. So what I want to show you is a really awesome diagram of the breast. This isn't a lactating breast, this is just a breast. They're amazing anyway. What I want you to notice is these are the glands, the gland tissue here where milk is produced and stored. The blood supply comes into the glands, and that's where milk and lactation happens. Lactation starts at around 16 weeks, and that's when your tissue begins sort of to produce those cells that are going to eventually create your milk. So that's where that will be. These are your ducts here, and there's the end of your nipple. And what used to not frustrate me, but what people used to, I found that they used to do was, when trying to hand express, they would try and squeeze this part here, but really that is just where the sort of the duct ends are. And if you can imagine trying to squeeze the tube of toothpaste right near the exit, that's not going to really yield much of a result. So bearing this in mind, where the glandular tissue is where you need to be putting the pressure on. Okay, so I've got my fantastic little knitted boob here, because no one really wants to see my knockers. But if you can imagine, you've got to think about where that tissue is. It's actually sort of around here rather than at the end. This is just the exit. So making sure you've got really super clean hands, really wash your hands really well, scrub your nails if you need to. And what you're wanting to do is you're putting your fingers sort of around the margin of your areola. You're pushing back and then together. And that's how you're trying to eject the milk out. Now, whether you can hand express a lot or a little does not indicate how much your supply is. Some women have an abundance of milk and can put an electric breast pump on for half an hour and yield very little in the bottle. Does not mean that you don't have milk, because your baby actually provides nothing can be more effective at removing milk than your baby, because they not only provide positive pressure, they also provide a suction as well as that positive pressure. So nothing will replicate your baby's attachment, and a pump or what you get by hand expressing is no indication of your supply. Also, the size of your boobs does not equate to how much milk you'll produce either. It's about the glandular tissue within the breast. Everyone's got a different sort of storage capacity, so your baby may need to feed more frequently, and that's totally normal. As long as they're looking like they're putting on weight every month, they're having lots of wet nappies, lots of poopy nappies, then that's what you're looking at. You're looking at a few more things other than just what it looks like in a container or a bottle. So what you want to do, and as you can imagine, those glandular tissue lobes are actually all the way around your breast. So if you're pressing in this area, you're not activating these ones as well. So it makes sense to change the orientation of where you're putting pressure on the breast. And you might find you've got like one section that's an absolute killer. I used to find one section would spray across the room. So imagine that you're pushing back. You're not pulling forward on the breast, and that's quite instinctive. A lot of people tend to think that they're a cow. We are not a cow. We're a mammal. Cows aren't the only mammals. But you're not pulling forward on the breast. You're actually ejecting it from behind. Make sense? So that's what you want to do with really clean hands. Now, there's a few ways you can collect it. If you have a sterile or a clean cup, you can be hand expressing and holding the cup underneath and putting the drops into there, or you can get yourself a clean spoon. And once you've got the clean spoon, you can actually get a little 1 ml syringe. This is a 3 ml syringe. You can get yourself a syringe, open the pack, suck the colostrum up. Sometimes you need to tap it, draw it down and bring it up again. Don't fill it all the way to the end because sometimes it does spill. And then put it back in its plastic container, put it in a container in the fridge. You can put a date on it as well. Put it in the freezer, and contain those until your birth or after your baby's been born. The other thing you can do if you're really tricky is actually, as you're expressing, you can sort of suck little bits up into the syringe. Again, you need to tap it, draw down, push it up, so you don't end up with a syringe full of air. So you're pushing in, you're pushing together, and you're sort of drawing it up like that. Anyway, so hopefully that's given you a bit of an idea and a bit of confidence around expressing. Even if you don't do it antenatally, it's a really handy skill to have postnatally. If you don't have an electric breast pump, you're actually able to, like I particularly was able to hand express quite easily, really large amounts. Again, breast pumps can be a lot more effective and a lot more efficient, but hand expressing it can be just as good. What else did I want to say, baby brain? So speak to your healthcare professional before you start doing it. You can make sure your hands are really clean. There are some certain circumstances that you wouldn't express antenatally. You would not express antenatally before 36 weeks. You would not express antenatally if you have issues with threatened preterm labour. You wouldn't hand express antenatally if there were complications due to if they were worried about your uterine activity. So if you'd had a previous classical caesarean section or multiple caesarean sections, you want to minimise any extra uterine activity. Because when you express, you're stimulating the sort of labour hormones as well, and it can make your uterus start contracting with Braxton Hicks. So there are a few circumstances that you wouldn't antenatally express, but again, discuss it with your care provider and they will be able to guide you. Second to that, have a look on the Australian Breastfeeding Association website, and there's some fantastic citations from different studies that have shown some great positives to hand expressing. Anyway, thanks for watching.